everybody. Welcome to the Unshackled Moms Alliance. Today, I have a guest that I know each and every one of you is going to want to hear because she has so much incredible wisdom and insight into mommying and breastfeeding. This is Krista Cassel. Woo! And welcome to the Unshackled Moms Alliance. She has her own company that she's going to tell us a little bit about. And don't forget, I always forget to remind you, but don't forget to click the like and a subscribe button. And also, there's a little bell that will, if you click on that, then it will show you whenever we have new videos because we have some really fantastic interviews coming up this month, including adoption and how to put your kids to bed, whether they're babies all the way through high school. And so there's lots of great things coming up. But right now, welcome, Krista. Thanks for coming on our show.
Thank you, Lisa, thank you so much for having me. I'm really excited to be here and love what you're doing with Unshackled Moms.
Absolutely. So tell us a little bit about the name of your company and what you do and all that good stuff.
Yeah, so I am a pediatric nurse practitioner by trade, and through my experience in working with moms and families, I also became an IBCLC or a lactation consultant. And so earlier this year, I started Gratitude and Grace Lactation, which is a virtual lactation practice that I do just kind of on the side because I sit with a lot of moms in primary care that are coming in with their newborns just completely overwhelmed by the amount of information that they're finding online. Some of the information that they find online is good information, and then some of it is really just not the best for them. So in the realm of social media and the online world, there's just an overabundance of information. And the thing that I have learned through years of working with moms and my own breastfeeding experiences is that each mom and baby, each breastfeeding journey is unique. So
Yeah.
I became a lactation consultant because I have 3 kids myself, and I nursed all 3 of them. Each one of those journeys looked very different. With my first child, who's now 11, I was in grad school at the time and working full time in the pediatric ICU as a nurse. And so we spent a lot of time back and forth between nursing when I could, but also pumping and bottle feeding as I was trying to finish school and clinicals. And then with my second child, I had the benefit of having her at a daycare that was on the campus of the clinic that I worked at. And so throughout the day, I was just able to go down and nurse her in between patients, which was a lovely experience. And we got to have a lot of bonding from that standpoint. And with my husband being able to feed him a lot because I was away, they have a very unique bond, which was really cool to see. But then with my third child, he was born in 2020 during COVID, and I really struggled. I had some changes in my body between my second and my third, and ended up having to use nipple shields, and with that, struggle with low milk production. And he just wasn't gaining weight, and there wasn't a lot of lactation support at the time. And so I was going into my pediatrician office, and, they were just like, well, he's not, back to his birth weight yet. We would expect him to be back to birth weight. Can you just give him more milk? And I'm like, giving him all the milk that I have. Like, what do you mean? Just give him more milk. And so, they were like, well, you're a 3-time breastfeeding mom, like latching's going okay. But nobody ever asked about, like, they didn't know. And there was no lactation support at the time because nobody wanted to be within 6 feet of you during COVID. So there was just a lot of things that missed, and I felt very alone. I struggled with some postpartum anxiety and depression because of the guilt that I was experiencing. I felt like I was starving my baby. Why wasn't my baby growing? Why was this so hard this time around? And then, the world was in isolation. So when I joined the pediatric office that I'm at now, the pediatrician that I worked for asked if there was anything that I was passionate about. And it was exactly that I wanted to make sure that no more moms felt alone in their breastfeeding journey.
I
So
love
from
that.
there, yeah, from
Well,
there,
and
I
I
just,
think that, um, there's so much we already have so much mama guilt as it is, whether
That's
it's
right.
having to leave them or whether, for daycare or any of those kind of things. And then, they give you this sweet piece of you when after they're born, after your babies are born, they give you this sweet little newborn and they go, okay, go, you can go home, right?
Right.
And I mean, hopefully they've had lactation specialist that comes in and that, latching on is all that has happened. But if there's any complications, I know that I was pretty sure that my oldest was never gonna latch on. Like, I had all the specialists come in, it never happened, and I'm like I just remember feeling just this horrible sense of, I can't provide for my baby, right? And
Right.
and I don't want to give her formula, but, like, what am I gonna do? And just, it's just such a mini trauma, right? Because you have this baby, you're already feeling a little insecure. Even if you already had 2 babies and you're bringing your 3rd home, it still is that anxiety because each baby is so different. And then, to have, um just to finally he did latch on, we went home, it was great. But I know that you're right. So many times people look online and there's good information and there's bad information, but, to just that what a comfort to have somebody to come on and just be able to walk you through the whole process. That you can because once you buckle them in the little car seat, and you leave the hospital or you leave the birthing place or wherever you've given birth, then like you're on your own. So I love
Yeah.
everything that you do. I love that you have some experience in your own kids, right? Which are you it's so interesting that it's kind of backwards, right? Because it seems like that first baby is the one that's like, "Oh my gosh, I have to use the nipple shields, I have to do all those things." But, it kinda like it was your 3rd one, and I'm sure part of you is like, "I should know this by now. I've done this
Right.
twice already," right? And so I love everything that you're doing.
Yeah, that's right. And I really believe, just kind of like what you referenced there, that lactation care is relational. Like, to
Mhm.
have, and that's the foundation of what I do with gratitude and grace, is that I don't want to just come in and fix problems. I can and I do. And in, my day job, that's what I do a lot. People come to me because they're having a lactation problem, right? But if you have somebody, like for example, a doula, you have somebody that comes with you throughout your pregnancy and walks alongside you during that transition to, your postpartum, that 4th trimester. Lactation care should be the same way, in the same way that we have preventive care, like your checkups and stuff. Whenever, you bring your child to the doctor, you come in and, we say, okay, yeah, everything looks good today. And this is what to expect in the next several weeks. That is the approach that I take with gratitude and grace, and that it is grace over guilt. So I walk with you. We combat, those feelings of, okay, this isn't going right, but from a framework of gratitude, what is working well right now and how can we
Mhm.
work with that?
I love that. I love that. I use so when I coach parents one-on-one, that's kind of the same attitude and same theory that I take too is like, well, okay, I know it feels like your house is completely blowing up, right? But what is going right? Because, it's that whole strength based, whether you're in the classroom, whether you're in, coaching or whatever that looks like. I just can appreciate that so much. So, how does faith play a role in your approach to supporting moms?
Yeah. So faith has been foundational to my survival in motherhood, my own personal survival in motherhood. If I had not began to understand about the fact that I really have no control. Like, we have, these things that we want to control in life. And when you understand how to surrender those things at the feet of Jesus, it is just so freeing. Because
Mhm.
there are so many things that we truly have no control of. I mean, even down to, moms come up with what they want for their birth plan. And ultimately, like, you can have your desires and your wants and your expectations, but, if your baby is breech, like, unfortunately, there is just not really a way that you can get through that without a C-section. You can try the external version and all of these other things. You can try and get them to turn, but until you just kind of surrender that you have no control in that situation.
Yep.
Um, then, you're just, it feeds into all of that anxiety and the overwhelm. And so, what I do when I'm working with moms is that I just try and teach them, these are the things that you can control. You can, control um, how you respond to your baby. You can, control your environment that will help to facilitate a good latch. You can, equip yourself with all of these, with education and tools and all of these things. But ultimately, like, it comes down to that, what is most important. So it's that bonding, it's the fact that your baby is fed and growing and thriving. Um, and so surrendering those things that are outside of our control. Unfortunately, we have birth circumstances that may affect, how well your baby latches in the beginning, or if your baby comes prematurely, they, may not get to, nurse at the breast immediately, or there may be other health conditions that are well beyond our control.
Yep.
But, what can we control in this moment, and how can we help to facilitate your journey to meet your goals the best that we can? So it's, yeah, surrendering that control and having faith that, um, God will provide for your child. You were created to be the mom for this child in this moment,
Mhm.
and respond to your instincts and your baby's cues, and yeah, just believe
Yeah, I
in
think that
that.
that is so that for me, that is so incredibly powerful to think about that this baby was even before the beginning of time was planned for you at this time, right?
That's
And
right.
that you were created to be the mom of this gift that you were given.
That's
I
right.
love that. So you mentioned in another interview that gratitude is not a band-aid for pain. Can you expand on that for moms that feel exhausted and overwhelmed and are listening right now?
Yeah. So, you can't really just, if in a hard moment, you can't really just slap a thank you, Lord, on top of it and just expect that to fix your problem. But when you start to experience, or um, I see gratitude being the foundation for your mindset, right? So it doesn't change the load that we carry, but it changes how we carry them. Because really, in all
Mhm.
reality, when you surrender, like I was just talking about, you're not carrying this alone. And so then it just lifts that burden, um, to realize that we are not carrying this alone. That, one, you have Jesus walking with you in the moment, but then also it just changes your mindset, that yes, maybe I am really struggling to nurse my baby right now, but I have a healthy baby that's sitting here in front of me, and so I, enjoy and appreciate that right here. And where can we go from there? So it doesn't take away the mess, but it changes how we carry that load.
Yep, it totally is such a great perspective shift, right? Like, rather
Mhm.
than draining in the negative, it's really, shifting into the positive, which really I think does so many great things to get you through whatever you're facing in life.
That's right. Yeah. And it also kind of helps you set the standard for what your expectations are.
Yeah.
So, your expectation is that you, again, have a healthy, thriving, growing baby, and what's most important in this moment. Um, yeah.
Absolutely. So, how did your personal breastfeeding journey shape who you are as a mom and a professional?
Yeah. So I had to definitely learn to receive that grace for myself, obviously. Even though I had never really had to give my other babies formula, I did end up, when they said just give your baby more milk. That's what I did. It's not exactly what I expected for my feeding journey to look like with my baby during that time. But I received that grace, that, even if my baby was not was having to get some bottles and was receiving formula, that didn't change the type of mom that I was. It didn't change at all the fact that, I was trying to do the best by my baby. So
Mhm.
I learned to receive the grace, that I now try and extend, to for moms to learn as well. So Second Corinthians 12:9 says that, my grace is sufficient for you. And our weakness, basically, my power is made perfect in your weakness. So that's what Jesus is saying, is that when we receive grace, we are not just receiving this undeserved favor, this kind gift that he gives, but we are receiving his power. And so when you receive that grace, when you feel like you're at your lowest moment and, um, at your weakest point, you're actually that in that surrender, you're receiving power. And again, it's just so strengthening and so freeing to step into that.
Yeah, yeah. So, feeding schedules is a myth that you
Mhm.
often hear. Why do you think moms feel really pressured to follow strict schedules?
Yeah. So in our culture, again, it's that control. It kind of all boils down to, and I am one that really, like, I'm a type A personality. I like to control things. And
Yeah.
so that shift for me, again, like when I became a mom, and realizing the things I can control, the things that I can't, was huge. So I think that in our culture, like, you take control, you've got the reins, you do this, you do that. And so that is one way, that culture kind of feeds into it. And when, we often, like online, see all of the comparison too, I think that feeds into it. Like, you have these perfect babies that are sleeping through the night, at a young age, and you have this desire to have a good baby and the perfect schedule. Um, I
Uh,
think that really kind of plays into it, but ultimately, I have seen firsthand the way that feeding baby, I'm not going to name the program, but there are certain programs that, encourage feeding baby on a very structured, very rigid schedule. I see these babies just completely fall off of the growth chart and mom's milk
mm,
production tank once they drop those feeds at a certain time in the day, because we're completely ignoring baby's cues. Like, baby is not a robot. They don't know what time it is. They just know I'm hungry or I'm not hungry. They don't care if it's been 2 hours or 3 hours or 1 hour. They
mhm.
are going to communicate to you through, some different body language, like smacking the lips, putting their hand up to their mouth, having, tight fists, their body tone. And so when we go based on a clock, something outside of, what's unique for you and your baby, then, you're letting, again, something else control, um, your baby's cues, and then that can have a really negative impact on your milk production.
Yeah, and I think overall, that's a great parenting philosophy, right? So when you are given this gift of your baby, it's a human, right? Like
Right.
it's has its own needs, its own personality, its own name the list, right? But so it's so important from when they're little, newborn even, to like start feeding into helping to grow their strengths, helping to grow all the different pieces of who they are created to be. And part of that is, in my opinion, is feeding. Like, they know when they're hungry. They know when they need changed, all those simple things. And they express them in very different ways. Some babies will scream, some babies will, like, that's what you work with. But um I think that that is just such a great philosophy to have overall. But then you're right. We get hit with, well, why is your baby not speaking yet? Why is your baby not crawling yet? What do you mean your baby, sleeps 8 hours in the night, and doesn't wake up for feeding? You're starving your baby. But no,
Right.
it's really it's about nurturing that little human that you were given and allowing them, even at a newborn phase to make some of those decisions for themselves because we really, as parents, want to grow up and work ourselves out of a job, right?
Right.
I know when my oldest was, when I first brought him home, like he slept through the night and I was just like, oh my gosh, is that okay? What is he doing? Like he's,
Yeah.
he's in his diaper. Is that all right? And I unfortunately fell into that whole piece of, scheduling, but for a very brief period of time. Like I just was like, this just is not right. He is a created human being. I need to nurture that. But I think that there is pressure on social media and all those other different places that um her moms to be fit in the box. Well, babies don't fit in boxes.
That's right. Yeah.
So, how can moms trust their instincts if they feel kind of unsure about feeding?
Yeah. So I think that, when you're feeling unsure about feeding, trusting again that you were created to be their mom and that you
Mhm.
and your baby will have this unique bond and this communication that your baby will cue to you when they're hungry. Now you mentioned something that was exactly right, that sometimes babies, like, depending on their birth circumstances or unique physical things, maybe baby was born prematurely or something like that, that we actually do have to wake babies up and feed them on a schedule. And that's why NICU babies are on a schedule and things like that. So I don't want to say that your baby can never be on a schedule. Like sometimes that's in your baby's best interest and they actually do need that. But if you feel like something is not right when you're, thinking about like our maternal instincts, then, definitely seek support in that, whether it be from your provider, your OB, or lactation care for sure. But to back to your question about like, how can you trust your instincts? One is seeking support, because if you feel like that you're overwhelmed, like that phrase that it takes a village is 100% true. Like we were not created to do life alone. And while I'm also saying that there can be a lot of unwarranted information that we find on social media and things like that, you have your partner, you have, your family, your close friends, your church community, your providers, whether it be your baby's provider, your provider, lactation support that you can reach out to. And so if you are unsure about your own natural instincts, then the number one thing that I would say would be to seek help.
Yeah. Well, and I think especially if you're a first time mom or you have a baby that doesn't line up with what your experiences are, it can create so much self-doubt.
That's
And,
right.
and the reality is you trust your instincts because you do know your baby.
Mhm.
It's hard to remember that you you grew your baby inside your body, like, the cues have been there from the very beginning, and yet once that baby's born, we get just so overwhelmed, not to mention the hormone surge and all,
Yep.
postpartum and all the other pieces that play into, being a mom to this new creation, right? So,
Yeah.
you're right, I think it's important that you have, you can trust your partner, you can trust even your girlfriends, you can trust um, all the medical staff. But there's also something to be said about having somebody like you come alongside and
Mhm.
help walk through, that journey. Somebody that you can call, somebody to give resources to.
Yeah, the other thing that is important to know is that you're learning alongside your baby. Like your baby has never done this before, and even if you have, you've never done it together with this baby this time.
Yeah.
So,
True.
so you guys are learning each other together, and so you're going to communicate with your baby, and your baby's going to communicate back with you. And so, it is definitely something that we learn. And any new skill that you're practicing, the more opportunities that you have to practice, the better that you get at it. So
Yeah.
um yeah.
No, I love that. Giving yourself the grace to know that you're getting to know your baby out, outside, right?
Hmm. Hmm.
And getting to know, as a mom, learning what that means for this baby. Like it's okay if you mess up. in small ways, like you miss a cue, or now your baby's really screaming because you were like, oh well, last time you said you were hungry, you sucked on your now, and now you're screaming up top of your lungs. And it's just learning that progression, and it's okay to like miss a cue as long as you're following through and picking back up with it.
Yeah, and I think that you can also just get a lot of peace from prayer too, right? So like if
Hmm.
you feel unsure of your own instincts, like you can ask other people, but ultimately like go to God with it. So you
Yeah.
can ask God for wisdom and he'll give it to you. I mean, Proverbs 3:5 says to lean not on your own understanding, but to trust in the Lord with all of your heart. So,
Yep.
when you go to God in prayer, like, Lord, please help me to understand what my baby is communicating with me right now and give me peace and wisdom to know what that is.
Yeah. Yeah. So let's celebrate. What are your favorite fun facts about breastfeeding that most people might not know?
Yeah. So babies are born with instincts, obviously, and most people do know that. But did you know that your baby can self attach at the breast? So a
No.
newborn babies can actually crawl. They do something when they're placed skin to skin in that golden hour after birth. Babies will go through several different stages of awakening, like in their transition, but they can actually crawl. They will crawl and self attach to the breast if left undisturbed, which is really, really cool to see. Some really cool YouTube videos that you can find on that if you're curious. Breast milk is a living fluid, so it is constantly changing. So I love that as a fun fact because like people try and compare breast milk and formula. And I'm not to say that, like, again, I've had to use formula for my kids too. And there is definitely a time and a place for that. But there is just really no comparison. Like breast milk has over 200 bioactive, like living components in it, and it changes from day to day, morning to night. I mean, like your night milk has more melatonin to help baby sleep and help with, circadian rhythm regulation, whereas your day milk is going to have more, energy boosting components in it. And from the beginning of the feeding, your breast milk has, it's more like watering consistency to quench the thirst. And then towards the end of the feeding, it changes to become more fatty to help babies feel fuller. So it's just amazing that breast milk is just constantly changing like that. Another thing that all moms love to hear is that breastfeeding burns a lot of calories. So um,
Yay!
it actually takes more energy to produce breast milk for your baby than it does to grow baby during pregnancy. So that's why when you're breastfeeding, you are hungry all the time. It burns sometimes over 500 calories per day. So you will be very, very hungry, very, very thirsty when you're breastfeeding.
That's why they
And
send you home with that big water jug from the
that's right.
hospital, huh?
Yeah. Yeah, you can't ever your breasts are never really fully empty either. Like I hear a lot of moms say, I didn't have any more milk. Or, I couldn't feed my baby again because I didn't have milk. Your breasts you can't really run out of milk. Your breasts are never really fully empty. You'll always be able to, express some milk. And your body is constantly in refill mode. And so that's probably the number one, like most important thing that I want moms to know when I'm educating them is that breastfeeding is all about supply and demand. So the more that you demand, you drive that milk production up. And the less we demand, or baby's not doing a good job at removing milk from the breast, then it causes your milk production to go down.
Wow, that I
Yeah.
didn't know a lot of what you just shared. I
Yeah.
knew that that your breast milk is specifically designed for that baby that you're nursing at the time,
Yeah.
but I had no idea that they had all those different components of like, satisfying the thirst and then giving the fat so that the baby's full. And I know that if you eat spicy pizza, then it's going to have an effect. But I didn't like that is so fascinating. Our bodies
Yeah.
are so incredibly amazing.
That's right. Yeah, they were created to do some really amazing things.
Yep,
Newborn
that's
tummies are
exactly
also
right.
tiny. They're only about the size of a cherry. So little teeny tiny. I hear a lot of moms say like those they didn't have enough milk for their baby in the beginning, but that's why that colostrum is called liquid gold
Right.
because it's just drops and but that those drops are perfect because your baby's tummy really can't hold a whole lot. The average feeding on that first day of life is only about a teaspoon. So just tiny little bit.
Oh my goodness.
Yeah.
That's crazy.
Yep.
Okay, so what does milk communicate with the baby and vice versa?
Yeah. So, yeah, that is another really cool thing that I love about breast milk. When your baby is sick, if they are latching directly at the breast, and again, this is not to say like if you choose to be an exclusive pumper, like your baby's, you're still going to have some great antibodies in your breast milk for your baby and things. But when baby puts their mouth on the breast, their saliva actually mixes with your breast milk and enters into your body to tell your body what antibodies it needs to produce for that baby at that time. So that's another reason why I don't like for moms to have like this giant freezer full of milk that you see on social media, because the most important milk that your baby needs is the freshest milk possible, because that's going to be, good for combating what is going on with them at that time. And if your baby is sick, if you can nurse them directly at the breast as much as possible, that's going to be even better. It's going to be just like an antibiotic directly for your baby at that time.
So that brings up a really interesting point. So I know moms that, for whatever reason, are unable to breastfeed.
Mhm.
And so they purchase frozen milk from centers or from other moms or whatever that looks like. So is that milk better for the baby than, say, a formula, even though it's expressed in another mom? And how does that work?
Yeah, that's a really great question. So, 100%, if you are able to, there are more and more places that you can get donor milk. There's actually a really great company that I've had the pleasure of working with for a mom who has experienced some things that she's gone through. It's called Third Strand, and they work specifically for moms that have cancer or have had infant loss and things like that. But a lot of states are working to get like a public milk bank, because private milk sharing is not really ideal. It's definitely not the safest. It's not recommended, but breast milk, any breast milk over formula, is going to have a greater benefit. Now, if there is not an option um, for you to get breast milk for your baby in a safe way, then obviously, formula is a good alternative, much better than what we used to do years and years ago with mixing like the Karo syrup with all kinds of, those
Yes.
early formula concoctions.
Right. Yes. Yes.
But,
What about
um,
goat milk? I know I hear moms giving their newborns goat milk. Is it
yeah,
comparable to mother's milk or no?
goat milk is not. So now there are some approved goat milk formulas, okay, but goat milk is absolutely not safe to give your baby in any situation. So goat milk composition, the reason why some moms prefer to give their babies a goat milk based formula is because it's a little bit more gentle on the tummy, or if your baby has like cow milk protein sensitivity or they have a hard time digesting that, sometimes the goat milk protein can be a little bit more tolerated, but giving straight goat milk is absolutely not recommended.
All right, moms,
Yeah.
you've heard it here.
Yeah.
Don't be milking the goat and giving it to the baby.
No.
I know,
Yeah.
I think it's probably that Karo syrup generation because I've heard like older, like mother-in-laws and older, grandmas recommending goat milk. And I've heard a few moms say that, that's what they do. So
Mhm.
I I am all about raw milk and that like we do drink raw milk at my house. And so, I think it's always nice to debunk some of those myths that are out there.
Yeah. So another thing that I found, like as I was kind of going in my own nutritional journey, is that we are the only mammal on the planet that drinks another mammal's milk. And so that's why so many people are sensitive or intolerant to dairy products, right? Because I mean, there is literally no other mammal on the planet that's going to drink another mammal's milk. Um, so that was really something interesting that has just always stuck with me.
Yeah, I've heard that before too. I've heard people that have taken dairy out, not only
Mhm.
because they have an allergic reaction to it, but also because that, like, why are we drinking another creature's dairy?
Mhm. Mhm.
I'm all about raw milk. So all right. So you talked about liquid gold and colostrum. Why is that so important?
Yeah, the colostrum, again, it's that super concentrated nutrition. And in the beginning, it is like packed with antibodies. But, you know, another hot topic, since we're talking about like raw milk and all of those things, is like leaky gut syndrome, right? So, one of the things that I think, if even if you don't plan, like, even if you're like, yeah, I don't really think that I want to breastfeed, if you can just try and latch your baby a few times to get them that initial colostrum. That colostrum actually lines the coating of the gut to reduce, um, you know, for so that all of the nutrients and stuff that your baby will then be getting with the milk is actually absorbed and stays in the gut because, um, with what the colostrum does is it seals and closes, helps to close all of those tight junctures so that we can digest more effectively. And breast milk is very easily digested by babies. And so that's why, they stool so frequently too. But it has all of those the immune cells. It's got macronutrients, micronutrients, all in that teeny, teeny, tiny little teaspoon. And so that's why it is literally liquid gold. Any drop of colostrum, even if you try and latch your baby for a day, like those few drops of breast milk are still doing amazing things for your baby. And, you know, if they are latching at the breast, they are probably getting something. Like I said, a lot of moms think, well, nothing was coming out or I didn't see anything, but it is just those teeny, teeny, tiny little drops. And I'm sure that your baby has gotten something. So I encourage my moms when they come in prenatally and things like that, even if they don't think that they want to breastfeed, or even if they're thinking, well, I really think that I want to be more of an exclusive pumper. I'm going to be going back to work. Just try it. Just because of all of those great benefits that I've already mentioned. Like, for example, when baby saliva touches the breast, just try it and see what it feels like. Because you were literally created for this. Like, this is how humans have been nourished for
Yeah.
thousands of years.
So, okay, so that brings me to a quick question. Because you don't know what you don't know, right? So,
Mhm.
when your baby is born, um, is it not raw, but is it like open so then that colostrum goes in and kind of seals up their digestive tract? Is that what I hear you saying?
Right. Yeah. So while they've been in your tummy, they've been eating amniotic fluid, right? Just practicing
Yep.
for eating and digesting. And that's why they have that really thick, nasty green meconium stool to begin with, because it's all that amniotic fluid that's left in their gut. Um, so, but yeah, so if babies get formula from the very beginning, they tend to have more risk for gastrointestinal infections and inflammation and issues with leaky gut. Whereas we know that if babies get breast milk from the beginning, they have a much lower risk of all of those things. And it's from that breast milk consumption that literally helps to reduce the inflammation, closes those tight junctures in the intestinal tract so that things stay where they need to stay and that all of that nutrition is not leaking out into their gut where it shouldn't be.
Wow, that is fascinating. I had no idea.
Hmm.
So, moms, those who are getting ready to have babies, or those who just started having babies, or thinking about having a baby, I think that that is like what Krista is saying is so important, right? So, even if you're going to go to formula, like as I listened to her speak, like how important it is for your baby's life to not, to get that colostrum just that first day or so, right? Because it affects their health forever, right?
Yeah.
That is so incredibly important. I have a new thing that I'm gonna put on my "You Must Preach" to moms. Okay,
Yeah.
so
Yeah.
how does breastfeeding support sleep for both mom and baby? You talked a little bit about that, but can you go a little bit deeper in that?
Yeah. So, breastfeeding at night, giving that night milk helps because your breast milk at night is going to have more melatonin to support baby circadian rhythm. But it also helps moms to sleep because whenever you're nursing, you have that oxytocin release. And oxytocin is your love hormone, which is that feel good hormone. It causes you like that warm and tingly feeling. It's triggered by all of your senses. So, sight, sound, smell. That's why, like, sometimes I encourage moms that are having a hard time expressing milk for their babies to even have like a dirty onesie of their baby. Like if you're at work and you're pumping and you're having a hard time with your letdown, having a dirty onesie to smell, or watching videos of your baby cooing or crying can be helpful for your milk to release. But it helps moms when we latch baby. That oxytocin helps moms to then relax. It helps with that bonding. Babies also get that security and helps them to rest better as well.
That is so interesting. So, I had no idea that breastfeeding was so, um, intricate and so, like, daytime has certain and then nighttime also releases like, your body produces melatonin to give your baby so the baby sleeps, and then
Mhm.
also releases that oxytocin so that, you sleep as well. I love it.
Yeah.
I had no idea.
It's
I mean,
amazing.
I will not be nursing, but I will be sharing that with other moms. Okay,
Yeah.
so, how do you help moms recognize their value and impact even when, breastfeeding is difficult or extremely stressful?
Yeah. So just the fact, like when moms come to me and they feel like things are not going well and they're stressed out and overwhelmed, I always remind them like how lucky your baby is to have a mom who is concerned that their baby is getting enough milk, or that they are, being nourished appropriately. And, you know, just that in and of itself, like it is, as a parent, like that is your purpose, that bonding that you have together, is you can you revisit the question for me? I kind of lost my train of thought.
Oh, yeah, no problem at all.
Okay.
So, how do you help moms recognize their value and the impact that they have when breastfeeding is when it's really difficult and hard?
Yeah. Okay, okay. So there, just the fact that, again, that their baby is so lucky that they have a mom that is there reminding them, like validating their feelings when things do feel hard, that it is normal to worry. And, you know, that she's doing, just by the fact that her level of concern is exactly, what she should be. Like she is standing in the gap for her baby
Yeah,
at that time to, see what they need, and just again to receive that grace, that when things are hard, that you're
yep.
still doing the very best thing for your baby.
Yeah, I love that. So, what are 3 tips you'd give to every new mom about breastfeeding?
Yeah, so you kind of alluded to some of it already, but the cue thing is a big one. So watching your baby's cues, not the clock. Secondly, is that a good latch definitely makes all the difference. So a lot of moms have the misperception that breastfeeding is supposed to hurt, or that it's going to hurt for a little while and then I'll get used to it, or my nipples will toughen up eventually. But that if you're having like pinchy or cringy pain, or your nipples are cracked and bleeding, that is a sign that something is not going well and that you need help. So breastfeeding shouldn't hurt, and a good latch makes all the difference. And then thirdly, trusting God's design and give yourself grace. Because again, it's about that presence over perfection. Like you
Yep.
being present, bonding with your baby, being rooted in connection. It's not about the ounces or the minutes that you spend breastfeeding. It's that connection that you have with your babies.
Yeah, absolutely. So, how do you support moms who struggle with milk supply or feel like they're failing? And you touched a little bit about that, like there is milk coming out, but go a little
Mhm.
bit more into detail about that.
Yeah. So, I like to start with gratitude. Like I try and start all of my visits from a framework of gratitude, and then we normalize their feelings. Like it is very normal to worry. That many moms will feel worried that their baby is not getting enough in the beginning, but then we spend some time like seeing what those fears are, why she's feeling these feelings, and then reminding her that she's not failing, that her love and her presence with her baby is already feeding her baby from that bonding aspect.
Yeah.
And then educating, education is so important because I mean, you've said it several times, like what you don't know, what you don't know. And there was
Mhm.
even after breastfeeding three of my kids, like when I started my lactation education, and I have a doctorate in nursing practice in pediatrics. I knew
Yeah.
nothing about breastfeeding. Like, it just
Right.
blows my mind how much I didn't know. And so we talk about like what's normal, what's not normal, what are signs that your baby is getting milk, what are signs that your baby, maybe would be more concerning. And that, trying to avoid the pressure and the distraction from outside sources. So to kind of quiet the noise and focus on your unique connection, your unique situation with your baby.
Yeah, I think for me and several moms that I know, it's hard to trust because, like, when you put something in a bottle, you can go, okay, they got 4 ounces, right? But when I'm
Hmm.
breastfeeding, to
Hmm.
be able to go, okay, because I have this little tiny human and I'm supposed to help it, right? I'm so him, her, right? But being able to take a breath and say, okay, you know what? Even though my baby is 1 day, 1 week, even 1 month old, they are able to self regulate a little bit, right? Like they can tell me that they're hungry and that even though I can't physically see the ounces that they had, I can trust the baby. It's like building that trust again, building that relationship, right? I can trust the baby that my baby is going to tell me what they need.
Yeah, I do think that there are unique situations where, maybe like for example with me, like when baby is not gaining weight the way that we expect
Mhm.
that they would.
Yep.
I think that in the healthcare realm, we, tend to not be as sensitive to the way that we say things, how it affects a mom, because you may say your baby's not back to birth weight yet. And in that, our mindset as a mom translates to I'm a failure. I'm failing my
Yeah.
child.
Yep.
So I think that, trusting your instincts, like you can't just say, okay, well, I'm putting baby to the breast and, that's the end all be all. Like I'm doing what I'm supposed to be doing here. Like it takes, again, it takes a village, takes a community. You have to sometimes collaborate with a whole team of,
Mhm.
whether it be professionals or peer support groups. I love lactation support groups, even online virtual communities. I have, a Facebook community called Motherhood with Gratitude and Grace where, just receiving encouragement and things from that standpoint. But, you know, if, yes, we have instincts to, bond with our babies and have them communicate with us and feed them and things like that. But also we have instincts to know like when something is maybe not right, and when something
Mhm.
is not right, like, that doesn't mean that you're failing. It just means that we need more help, and it's okay to ask for help.
Yeah.
Asking for help is not a sign of weakness. It's actually a sign of strength, in my opinion, because you're recognizing, like, that something's wrong and, how important that is.
I think that is 100% correct, right? And whether it has to do with breastfeeding, whether it has to do with your kids going back to school and and they're coming home and saying something about their teacher that might be off, or they're coming home and saying something about another kid that might be off, or they're in second grade and they're not reading yet. Like all those things it's important to go and ask for help. It's important to
Uh-huh.
go and advocate for your baby and your child as they grow up. Even in high school, when they're playing football or whatever that looks like. You
Yeah.
know, it's okay to trust your instincts as a mom, and ask for help, ask questions, see what's really happening. I think that that is so important. So I think you brought up an interesting point. So about your education and where you are and how little you really knew truly about breastfeeding and all those different pieces. So
Right.
what are some of the things that you um wish that professionals knew, A, and B, what are some questions that moms, as they go in to see their OB, in preparation for having a baby, what are some of the things that they should be asking?
Yeah, so I wish that OBs would give moms more education on where they can find support. I think that it is so important that all moms take some sort of prenatal breastfeeding education class. And I teach these classes virtually weekly. You can find a lot of courses online. I'm developing a self-paced course, but I mean, they're everywhere. And a lot of the time it's they just don't know where to go for help,
Mhm.
or where to go to find this information. And if you, I think that when it comes to breastfeeding, if you go, or when it comes to doing anything, to be honest with you, if you go into it thinking that it's going to be really, really easy, or that it's, just natural, and it's going to come naturally, and then it's hard, it's so much easier to just give up and throw your hands up and say, "Puh, well, I tried." You know, whereas
Yeah,
if you go into something kind of knowing like, okay, it may be a little bit hard, but I have these things that I can do to try and overcome these hurdles, and I know where to go for help, then you're
yep,
more likely to be success in the long run. I mean, no matter what it is. So prenatal breastfeeding classes and courses, and I do one-on-one consultations as well, especially if you have like a history of, any sort of like chest trauma, surgeries, if you have certain medical histories like, hormonal issues, PCOS, thyroid, anything like that, those really need a unique care plan, for you, because, things may be a little bit more challenging for one reason or another, to know what kind of expectations would be realistic for you in your breastfeeding journey. So, I wish that when you're, because the OBs are your point of care, right? And so I wish that the OBs would really talk a little bit more about where moms can find this information. Or I also am working with a OBGYN here locally who is starting, they have like a prenatal group, where they do more of a group model of care about incorporating lactation care into that. It's just part of like your, when you start coming in for your, 36-week visit, 37-week visit, like, so that you're ready. And it's hard to know what to expect. Like, you spend 9 months focusing on that delivery that lasts, a day or so, hopefully no more than a day, but sometimes it's longer. And then you have, potentially months and months or years of breastfeeding that, some moms don't even prepare for. So, and years ago, back before formula was introduced, like, women grew up seeing their mothers latching babies, seeing their sisters latching babies, seeing friends latching their babies. And then now in our current world and our culture, like, you just don't see that. And so a lot of moms are going into something that they've never seen before, which,
yeah,
again, makes it really hard. And then as a primary care, provider as well, because I work in pediatric primary care. We, again, we are that point of contact. So, regardless of whether in our office, whether they're seeing me as their provider or not, all of our breastfeeding families have the option of seeing me at their initial newborn follow up appointment. So, instead of having to get your baby out and go to the pediatrician and then go to a lactation appointment after that, like, we do everything all in one package. And it is just so much more convenient for the families. We, have the opportunity to educate and recognize problems before they arise, because we do a thorough history and things like that. So I wish that more pediatric offices would adopt this model of care, because, incorporating lactation care into that point of access is, simplifies things for the families, and in all reality makes their journey more successful.
yeah. I think you brought up a really good point too, in that sometimes as moms, we just, write off, "I can't breastfeed
Right.
because I've had surgery," or because, maybe at one point I had breast cancer, or, like, whatever the reason,
Yeah.
right? They just go, "Well, I just can't. I have to move on to formula." But really, how important it is to have a conversation with your medical team and lactation specialist and talk about, like, it, don't throw it all out. Like there could be a possibility that you can still make it work, correct?
That's right. Yeah, that's right. So I am actually working with one of my good friends who had breast cancer. She's had a double mastectomy and is getting ready to have her third child. And she's planning on breastfeeding her baby. And I know that that sounds crazy, but we work with people who are non birthing parents, non lactating parents, like transgender individuals and things like that, that also can chest feed, breastfeed their babies with certain modifications. So that is definitely an option. I don't want really when it comes to breastfeeding, in my opinion, it is more so about that bonding experience, that connection. Breastfeeding your baby increases their IQ, it increases their cognitive function, it makes them smarter, even just by that skin to skin. So, nurturing your baby at the breast, at the chest, in this area is just a such an important way to create that bonding and connection between the two of you, whether or not they're actually getting your human milk at the breast or chest or not. So there are definitely ways, like if you work with a lactation professional, that we can help you achieve your breastfeeding goals. It may look different than what you would expect in certain situations, but yeah, it's definitely a possibility.
Ooh, I love that, and I love the idea that you brought up, whether it is an adoptive situation, a
Right.
transgender situation, whether like there's so many other situations that, the importance of that bonding, can happen no matter what no matter what that looks like, right? You can
Hmm.
still do some of those things to help create
That's
that
right.
bond.
Hmm.
So for moms returning to work, what is your go-to strategies for maintaining connections and milk supply?
Yeah. So, number one, I like to encourage when we go back to work that these wearables are a fantastic tool. They didn't have wearables when I was breastfeeding my babies, and I would think that that would have been really cool. Because, like I said, with my first one, I was working in the pediatric intensive care unit and I didn't always have time to like step away from the bedside. So to be able to like slip in a pump and pump while I'm there taking care of, my patient would have been awesome. But they are not a great primary pump all the time. So in terms of maintaining your milk production, I do recommend trying to use like a double electric pump when you're able to, like on your lunch break and things like that. Wearables are a good like intermittent pump, but I have worked with many moms and seen once they go back to work, if they're having to use a wearable pump all the time, that it really causes, a decrease in their milk production, unfortunately, because it just doesn't remove milk as effectively. So, have a double electric plug in the wall pump as your primary. And then, in terms of maintaining connection, try and really breastfeeding your baby when you're able to,
Mhm.
without adding extra stress. So especially like those bedtime nursing sessions are a really sweet opportunity to get to connect with your baby. Or, if you work night shift, I remember sitting when I was working in the pediatric intensive care unit, I would, we had one of those wireless cameras that I would like tap into and watch my husband bottle feeding my baby at 2 a.m. while I'm sitting here attached to the pump. So, that's not always feasible depending on the type of your job, but trying, having times that you can connect with your child at least once or twice a day. And I recommend that even now, like as my kids are bigger, like they need that special one on one time with you.
Mhm.
Having a one on one date with each of your children just helps to maintain that connection. So, when you're home, don't think that if you start having to introduce bottles because your baby's going to daycare or they're going to be at, grandparents' house or whatever, that you can't nurse your baby whenever you're together at home. Sometimes there can be some hurdles, like, baby may start to prefer a bottle. And so I always recommend continuing with a slow flow nipple because the size of your nipples never change. Like the flow from your nipple is not going to change throughout your breastfeeding journey. So we don't need to increase nipple size. throughout a baby's bottle feeding journey either. Um, but also pacing the bottle feeds, like don't overfeed them with a bottle, kind of let still following their cues. We live in a world of like a clean plate club. So we tend to want to, feed the baby till the bottle's empty, but they're going to feed till they're full at the breast. And so watching babies hunger and satiety cues, even when they're being bottle fed. And daycares, unfortunately tend to like to follow a schedule. Like my baby is going to eat every 3 hours. But if you are getting pushback from your daycare or grandparents or anything about how often that they want to feed, or like I have moms come in all the time that will say, well, they said that they think the baby's more hungry, um, and I need to give it more milk. But, that's not typically the case. They're just eating too fast and their brain and their body, brain and their belly don't have time to communicate. So pacing that bottle feed can be super helpful. And then just staying connected with a lactation professional throughout that transition. Is important because these are some of the hurdles that we often see. And, you know, you can't start feeding your baby 6 ounces from a bottle. And when you're only, you're going to run out of milk because most breastfed babies max out around 4 ounces every 2 to 3
Right?
hours. Like when you see these huge, 8, 10, 12 ounce bottles, that's not the norm. That's not what's normal.
So is there a bottle in particular that you recommend?
Bottle brands, no. I mean, there's not any one that I recommend for a variety of reasons, but I think that you just need to find one that works well for
Uh,
you and your baby. Um, but definitely, whatever the brand is, using a slow flow nipple and pacing those feeds.
I love it. Okay, um, so moms don't have to rewind. They've listened to this whole thing and they're like, "Oh my gosh, this woman knows what she's talking about," because you do. Can you share a little bit about what you do? Do you help anyone online? You said that you have maybe a Facebook group. Can you share a little bit about, again, remind us who you are as a business mama and what you do? How, and like, if for that mom who's sitting at home is like, "Oh my gosh, I need to talk to her." What does that need to look like?
Yeah. So, again, I'm Krista Cassel. I am a virtual lactation consultant in the virtual realm. I have Gratitude and Grace Lactation, which is a virtual, like for anybody, anywhere, private lactation practice. And I have currently one on one availability where I do prenatal, postpartum, follow up consultations. I prefer a more relational model of care. So I have like packages where, we work together for periods of time from prenatal to, postpartum and weaning. I also have so you can find me at www.gratitudeandgracelactation.com. I also have a Facebook page, Instagram, and then I have a Facebook community just for the encouragement component. So if you would love to, for moms in any season of motherhood, it's called Motherhood with Gratitude and Grace. And this is just a space where we come together and encourage and uplift one another. It's not lactation specific, but we grow together in grace and yeah, share all of those Me Too moments of motherhood.
I love that. And we will have all those links in the description. So if you're like, "Oh my gosh, I didn't have a pen, I couldn't write it down," it'll be down there. You can click on that. So what I hear you saying is like, so if you are living in the backwoods of Montana or you are living in Sacramento, we can still have you have a package and we can still have access to you. Yes.
That's right. Yeah. So I especially have a heart for moms in rural areas because I actually moved to Georgia from an urban area to a very tiny small town in rural Georgia. And there are many moms that will drive over an hour to see me. I'm in the Columbus, Georgia area in person, but that's not practical when you have a newborn, to hop in the car and drive, 1 to 2 hours to see a lactation professional. And, there's a lot in the big city areas. You can typically find a lot of lactation care. But for those, in more remote areas and things like that, it is definitely having virtual lactation care we can do pretty much anything, as much as if I were sitting on the couch next to you.
Oh, I love that.
Yeah.
Okay. So we'll have that link so you can link that. Oh my gosh, my brain is completely full. You have shared so much amazing information. To switch gears a little bit, I always like to end my each interview with rapid fire questions. So
Okay.
I will read it to you and you just talk about the first thing that comes to mind. Reality
Okay.
says usually they're supposed to be rapid fire, but it always piques my interest and I usually end up discussing anyway. But let's try. All right. Coffee or tea?
Coffee.
How do you like your coffee?
Hot, definitely. I do like tea too. I like it. So I'm cold all the time. So I like anything hot.
Oh, gotcha.
So I will usually do coffee in the morning, tea in the afternoon.
Do you put cream? Are you like a gourmet? Let's go to the thing or just black?
I like, I really don't like sweet a whole lot. So I like black
Mhm.
coffee with a tiny little bit of non dairy creamer and a sprinkle of cinnamon.
Ooh, ooh, yum.
Yeah.
All right.
Yeah.
The song that always lifts your mood.
A song.
Mhm.
Oh gosh. Right now it is probably Josiah Queen and Brandon Lake, their joy.
I love it. Okay.
Mhm.
Baby product you would recommend to every single mom.
Your breasts? Can I say that?
That's
Gosh.
good.
Yeah, I really love the mm, that's tough. I don't have one.
No.
Um,
I know a lot of moms right now like those muslin blankets.
yeah, I loved baby wearing, especially when I had multiples. So it would probably be like an ergo carrier or a baby, like a Moby baby wrap or something like that.
Oh yeah,
Just some sort of baby carrier. I don't like recommend a specific brand, but baby carrier, good to go.
for sure. A place or a piece of advice that you wish that you had ignored as a mom.
Hmm. That, gosh, that's tough. That I wasn't enough for my baby, that
Mhm.
I wasn't making enough milk for my baby because it wasn't true. I just needed, yeah, the additional support.
Yeah,
So,
yeah.
yeah,
One word of encouragement you'd want every mom listening to hear today.
that you are not alone in this journey.
Absolutely. I love it. Well, thank you again for being on. I'll have all the information in the description so you mamas who are listening can click on that and learn more about Krista and everything that she does, and maybe be able to connect with her so that you can have her on the couch, the virtual couch next to you. Thanks again. Don't forget to hit the like and the subscribe button, and then also hit that bell so that you know when all the upcoming cool um podcasts are coming out. Thanks again.